I have fond memories of playing outdoors as a child. Holidays spent at the beach, summers goofing around on a playground, even studying under the sun before end-of-the-year tests. While those fun moments made happy memories, it turns out that all that unprotected time in the sun may have done some lasting damage that I won't see for years. That damage is basal cell carcinoma. Basal cell carcinomas arise in the skin's basal cells that line the deepest layers of the epidermis, or the outer skin.
Basal cell skin cancer is the #1 most common form of skin cancer. It's most common to occur on sun-exposed regions, such as anywhere on the face, ears, or scalp, but can occur anywhere on the trunk and extremities. There are many different causes of skin cancer. For the vast majority of patients who have basal cell cancer, it's overexposure to the sun. And usually that exposure occurs during early childhood or one's early teenage years. Sunbathing, frequenting tanning salons, vacationing in sunny places, and experiencing sunburns.
Basal cell carcinoma usually manifests as an open sore, an irritated red patch or growth, a white waxy scar, or a shiny nodule.
Patients are usually educated to look for a crust or a mole or a spot that doesn't heal or bleeds or persists. And pictures of these things we actually go over with patients in educational pamphlets, and we advise them to go online and do some reading so that they can educate themselves as far as what to look out for.
A pimple, injury, or red patch should heal in a normal, healthy person who takes care of himself in about a week. However, something that persists longer than that, say a month, 2 months, even 6 months, should prompt medical attention. This timeline is also true with suspicious marks that appear, disappear, and reappear. The waxing and waning isn't as important as when it first appeared. A dermatologist will first diagnose a skin cancer with a physical exam and then a biopsy. Basal cell carcinoma is easy to treat in the early stages, and it's important to address it as soon as possible.
Typically, basal cell cancers are what's considered to be locally aggressive or locally infiltrative tumors that do not metastasize or travel throughout the body. They therefore are very rarely life-threatening. However, they can be health-threatening because they are more destructive than anything else, which is why they need to be managed.
The aggressiveness of the cancer will dictate treatment. Other deciding factors will be the patient's age, their overall health, the location and size of the cancer, and previously performed treatment options. There are many treatment options available.
Some of the different treatment options for skin cancers include something called a wide local excision, which is the same type of technique used for melanomas. Typically, that procedure is performed in the office, usually under local anesthetic, where a margin of what's considered healthy tissue is excised around what is perceived to be the roots or edges of the skin cancer. That specimen is then sent to a lab. The pathologist will section through the block of tissue to make sure that the edges are clean, and the surgical defect is then repaired with sutures.
Another similar treatment is known as an ED&C, which stands for electrodesiccation and curettage. This is an in-office procedure performed under local anesthetic. The tumor is scraped or curetted off the surface of the skin. It's very quick, relatively safe, and has limited, if no downtime for the patient. However, it's considered a blind procedure, and there's a slightly higher risk of recurrence as a result.
These days, there are other options for skin cancers, which include topical chemotherapy creams or medications that can actually medically clear the roots or the cells that are abnormal. Again, used more for basal cell and squamous cell cancers in certain situations. The last form of treatment is liquid nitrogen therapy, or what's called cryosurgery, where liquid nitrogen gas is essentially frozen onto the skin to burn the surface and roots of the tissue to cause what's called a crust, and then the crust peels off, hopefully with the roots of the cancer involved. A relatively quick, safe, easy procedure.
There are an estimated 2.8 million cases of basal cell carcinoma in the United States every year. Don't be one of them. Wear sunscreen, preferably with a broad spectrum of UV protection. Wear protective clothing. Wear a hat that provides shade, and seek shade during the peak sun hours between approximately 10 a.m. and 2 or 3 p.m. We also encourage patients to do self-examinations at home. And be sure to do the same for your kids. They can have a happy, sunny childhood while hopefully avoiding a basal cell cancer diagnosis in the future. I'm Dr. Mike Rosen, and you're watching the eHealth Network. See you next time.